Here is a very basic beginner mobility routine, especially if you have thoracic and hip mobility issues. This is specifically made for women 40 plus. Here is me doing what is called a thoracic car, which is a controlled articular rotation. Notice this looks like a very similar yoga pose, but what I'm doing is as I'm dropping my head, I am going segment by segment down my thoracic spine, trying to get into my lumbar spine. And as I get lower, I am engaging my abs. Then I reverse it, come back up from the bottom up, going segment by segment. This segmental control is a mobilization for myself for my stiff thoracic spine. Every woman I see in clinic has a stiff thoracic spine. This is something all of us should do, and as we age, our ligaments get stiffer and our tendons get stiffer, and we have to work to have mobility. Here I am doing a nice stretch for the thoracic spine. Here I am doing the thread the needle. This is going to help your mid-back pain because your thoracic spine does flexion, extension, and rotation. Sliding that arm under, as you see here, for thread the needle helps me improve my rotation. Now, even though this video is done in real time, I have left out some reps to kind of shorten it a bit. It is truly a 10-minute routine, although you really only see 8 minutes. Everything I'm doing is 4 to 5 reps. Here is an example of hip cars, which is controlled articular rotations. And this is a hip mobility. I'm going to do 4 to 5 reps on each side. Notice I flex my leg up and then I come out and back. So flexing up, come out, go back, not unlike the fire hydrant. I'm a little shaky as I get towards the back because I have dysfunction there. This helps my hip internal rotation. Here's the beginning part where you just go side to side. If you get a little better, go wider. Get your knee all the way to the ground. Once again, 4 to 5 reps each side. I never want pain or pinching with this. Never, never, never. So now I'm going to do a straight leg raise. Yes, I am sitting up, and yes, this is a mobility routine, but working on our hip flexors will actually help us mobilize our hips. It's a weird thing, I know, but trust me, it makes a difference. Once again, 4 to 5 reps and no pinching in your hips. If it's pinching, lay back more. Now I'm going to do a bridge, but not just any bridge. It is a car, the controlled articular rotation to help my lumbar spine mobility. Lumbar spine is your low back. So as I go up, I'm curling up segment by segment. As I come down, I'm starting from the top down and really trying to make sure I have control of what I'm doing. I'm going very slow. I'm being very purposeful. Once I'm all the way up, I am making sure I'm engaging both my glutes equally. One of the things that happens with women is one glute might be stronger, so please try to remember to engage both your glutes. So squeeze your baby butt cheeks when you get to the top. This is perfect for low back pain and SI joint dysfunction. And honestly, the glutes are something that goes with time. This is a nerve glide. This is mobilizing your sciatic nerve. I call this ankle pumps. I'm probably going to do 2 sets of 15 on each side. And as I move my foot back and forth, I am flossing my sciatic nerve through my hamstrings and all the various structures. Our nerves need to be able to move and slide and glide between all these structures. Now I'm doing double kneaded chest and just gently going side to side to loosen up my pelvis. No pain. I don't want any pain. Now I'm going to do 10 backward pelvic tilts, which helps floss the nerves of the low back and helps mobilize your lumbar spine and your pelvis. As I'm doing this, I am also engaging my abs because I have to engage my abs to make this motion happen. I never want pain with this. Now I'm going to do some cervical range of motion. This is called a cervical car, controlled articular rotation, and I'm going very slow, segment by segment. If you have any dizziness or history of drop attacks, please don't do this. If you do feel dizzy or pain, please keep a smaller range. I always encourage my patients to stay within their pain-free range. I might do 3 to 4 of these because my neck can get a little fired up. And I do hear a little bit of cracking, but it is not painful and not problematic for me. Next, we're going to do thoracic cars. So I'm going to come down forward into flexion and go segment by segment. So I'm tucking my head and going from the top, rolling through. Does it look perfect? Heck no. I I have a stiff thoracic spine from working my job. You can see how the upper part of my back doesn't really curve as well as it should because it's so stiff. That's why I'm doing this. Also, pay no mind to my menopause belly. Welcome. If you're 40 plus, I pray you don't get this. Let me be your example of fighting that. So it's really hard once I get to this point for my mobility. I'm really trying to get that motion. So once again, 4 to 5 times for these cars. It's harder than it looks. It looks so silly and simple. Now I'm going to just do a little bit of a nerve glide, just kind of bringing my heels up. My toes are trying to touch my hands are trying to touch the floor. My toes are totally touching the floor. Anyway, just a little warm up. No pain there. Next, I'm going to do a standing hip car. So flexion, coming out, going back into extension, in. Kind of looks like I'm going to go on a fire hydrant. I have my hand on the wall to balance me because my left glute med is weak. We're going to do this again without support. 4 to 5 reps. If this feels too hard for you, you can do it on your hands and knees, or you can do it on your side. Oh, my butt got tired. See, I fell over. Now I'm going to do scapular cars. This is one of the greatest things to help your thoracic spine have less pain. I am in pain right here. I'm a little stiff. It's kind of like I have a hitch in my giddy up and I'm struggling to do this. Let's do this from the other side. So I'm going forward, down, back, up, forward, down, back, up. Kind of like a little choo-choo train. But this really helps your upper traps feel more pliable and loose. Here are shoulder cars. Just going through my full range. And I don't always look perfect at the beginning because there's like catches and I'm stiff and I'm not perfect and I have a lot of arthritis. And I almost debated, do I show people what I really look like doing this because I don't look like everybody else? And I thought, yes, this is real. This is real life. I'm a physical therapist. I have pain just like you. And I am demonstrating what a real normal mortal looks like doing this. So 4 to 5 reps, both arms. Staying within your pain-free range. And cars for the thoracic spine one more time, seeing if I loosen myself up a little more. And that's it.